पळोवया खबरो विस्तारान। केंद्र सरकाराच्या राष्ट्रीय वैद्यकीय आयोग विधेयकाक देशभरांतल्या दोतोरांनी विरोध उक्तायला। हे विधेयक रद्द करचे म्हण मागणी देशभरांतले डॉक्टर संघटना करतात। ह्या निमतान देशभर दोतोर संपार गेल्ले। गोंयांतय दोतोरांनी शेनवारा हो संप पाळो। आरडेक्सको खातीर पणजेच्यान चीफ रिपोर्टर कॅन्झल रॉड्रिगीस।
And one of the most important clause for general public to know is how this is bad for general public at large, because about more than 50% of the seats in the medical colleges will be directly given to the private quota. That means there will be auctions, so they won't have any fixed price tag for that. They can put any price, and as an medical education खूप costly जातले. General पुलांतल्यान फक्त अबाउट लेस देन 50% डॉक्टर्सांक मेळटले। हे बरोबर न्हू। आनी फाल्यां सकाळी आफ्टर सम टायम मोस्ट ऑफ द पीपल हू वूड लायक टू हॅव देर चिल्ड्रन्स टू बिकम अ डॉक्टर, देट ड्रीम विल बी शटर्ड बिकॉज ऑफ द मनी, बिकॉज ओनली द रिच पीपल विल बी एबल टू गेट अ मेडिकल एड्युकेशन्स, एंड इवन दोज हू आर इन मेरिट दे ऑल्सो विल नॉट गेट इट, बिकॉज मेरिट लिस्ट ऑल्सो विल बी लेस देन हाफ. So this part general public should understand. And this strike is just not of doctors at large, but it should be a movement of a public at large, because how the public is going to be affected of this. Government also had another clause to allow non-allopathic doctor to practice the subject which they don't know. It's like mechanic doing an engineering, or mechanic is just training for about 1 month and making him an engineer. This is not possible by doing somebody who is trained as some other system of medicine to directly allow him to practice in the allopathy, the highest standard of medicine, without being a proper training of 5 years minimum, which is 5.5 years minimum, which is required at the moment. So this is going to be mass. Government, after the protest from the IMA and informing them what nonsense they are doing, they have agreed to remove that brief course of 6 months, which is supposed to be given to the other branches of medicine to make it allopathic. But they have not totally wiped it off. They had put a clause that it is left to the state government to do what they want and how to handle the health issues of the rural health areas. And whether this bridge course and anything also has been totally abolished. So government should make it proper, this thing. Everybody needs a health care. It can be delivered with the healthcare workers and the allopathic doctors required. And society needs a good doctor. That can come from the society if the good people, as the highest, those who are getting a good mark, tomorrow comes in the medical system. And this is the future of India that we have to shape. And that's exactly what the public should know, and public should pressurize the lawmakers, because they are the one who has to be banned down. And it is the people at large who can ban them. That's what.
Yeah.
Thank you.
Doctors, this law.
Well, it is not more an effect on doctors. It is more an effect on the public. As Dr. has just now explained, it is going to be very deleterious for medical education. So our younger generation will not get on merit the seats. And because of that, the future generations to come, even maybe if I live to be old, I may have to be treated by a doctor who is not competent enough because he's got a seat on payment and not on merit. So people should understand the magnitude of the problem. It is not a problem for doctors only. It is more a problem for the public. What we are interested as doctors is in the general health of the public. In the general health of the public is affected by not so qualified and not so competent doctors. How is the healthcare system in our country going to run? As it is under a big burden. And if we have incompetent doctors who are going to come up through this system, then it is going to be a real blot on the healthcare of our country and on our country in general.
Thank you.